Welcome back to Exponential Investor, the Money Week podcast dedicated to next generation technology and the investment opportunities it provides. Later on, I'll be talking to the CEO of Exobionics, a listed robotics company that helps rehabilitate the victims of neurological damage. Earlier this month, Exo received FDA approval for the use of its GT exoskeleton by recovering stroke victims. It's already in use in the US and Europe. Assistive exoskeletons have only recently become practical, but they look likely to be rolled out not just for medical use, but for industrial and even military purposes. You can hear all about it in the second part of this podcast. Before that, Nick and I are going to run through this week's biggest tech news. If you want to know more about the stories we discuss, or have questions about the exoskeleton technology or anything else, get in touch at misha@moneyweek.com. Enjoy the show. So I'm here again with Nick, the publisher of Exponential Investor and Frontier Tech Investor, and we're going to go through the news quickly. Nick, what's your first story?
First story I have today it's a story that Owen Tracy sent to me yesterday, mostly because he's been working on the cover story for Money Week magazine this week. So you can look out for that if you're a subscriber, or if you're not, I'll try and sneak it out one way or the other, especially if you're a Frontier Tech Investor subscriber. He's writing the story about robotics and assistive technology. So that's kind of how technology can work with the human body to help us do things that we either can't or wouldn't be able to do ourselves. So it might be to go places we couldn't go on our own, or to help people do things that for one reason or another they can't do at the moment. He's found a few companies that are doing some pretty interesting stuff, which we'll talk about maybe in a different show. But the story he sent me was something that's quite far out there on the whole assistive tech development front. It's I'll just read the beginning of the story for you. Quadriplegic man is first to regain use of hand and fingers. 6 years ago, Ian Burkhart was paralysed in a diving accident. Today, he can swipe a credit card, pour a drink, or even play a guitar video game. His fingers and hand movements driven by his own thoughts. No prosthetic arm or robot required. It's because doctors in the United States have developed and surgically implanted the first neural bypass for spinal cord injuries that reconnects the brain to muscles. So it's kind of like a brain-body interface, bridges the gap that's been severed because he's had a spinal injury using technology. So that's quite far out there. But I thought it was a nice little example of the way, of what assistive technology could ultimately do.
That is very interesting. It's a nice story because for people who don't understand a great deal of this science, myself included, that's quite easy to understand. People in general understand kind of nerve transmission, electric signals to the brain, and that clearly is kind of almost a broken part of the body being replaced like for like by a machine part, it seems. Yeah,
and it's part of a bigger story, I think, which is one that I think we should probably bang the drum on, which is when it comes to robots, robotics, technology, things like that. I think probably science fiction and just there's a general sense in the world that those things can be bad for humans. Robots could replace us in the workforce, or could be malign in some way. And okay, so we're not here to debate whether or not that is or isn't true. But assistive technology is the other side of that coin. It's using technology as a tool to do things that we can't do at the moment. Just in the same way as we use a car to drive somewhere, use a plane to fly somewhere. We use technology all the time just as a pure just as a tool. It's secular. It's not like, this is good for humanity or bad for humanity. It's just we need to do something, and this technology is going to enable us to do it. This is kind of another step on that, in that direction. But it's the same principles, integrating technology with the human body to make our lives better, which is ultimately the goal of what technology should do.
I was speaking, as you know, the other week to the CEO of a company called Exobionics that makes these robotic suits to help rehabilitate victims of neurological disease. And that's exactly that kind of thing, that robots are not inherently malign at all. This helps people with strokes and spinal injuries rehabilitate faster. And it is an assistive technology. It's nothing particularly mystical. It just gives people strength they wouldn't normally have. And as you say, assistive technology is really the kind of deployable cutting edge of practical robotics. That's what's happening next, and that's what's worth focusing on.
Yeah, so it's certainly something that we're going to look more at. I know Owen has looked at it from a more financial point of view in Money Week magazine, and I know that if you're a Frontier Tech Investor subscriber, you'll be hearing a lot more about that in the upcoming issue, which Owen myself and particularly Misha. Misha's going off on a special adventure in a couple of days' time, which I'm not going to tell you any more about, but will be pretty cool if we can pull it off, and it's to do with assistive technology, so you'll have to watch this space on that one.
Exactly. So let's move on. So the first story I've got today is about this brain print. Did you see this?
No.
It's a team of computer science and psychology professors at a university in upstate New York have managed to identify people by their brainwaves with 100% accuracy. So what they do is they strap a kind of, I don't know if you've ever had an EKG or an EEG brain scan.
I have. It was crazy.
It is crazy, isn't it? I've had one that determined I wasn't epileptic, which was great news.
This is exactly the same as what I had.
Oh, brilliant.
There you go.
Nice one.
Nice one. Well done, guys.
They strapped the participants with an EKG headset, and they showed them a series of images and determined their responses, and they were eventually able, with 100% accuracy, to determine who was which person.
That's crazy.
It is crazy, and they think they're going to use it mostly because it's so expensive initially in high security locations, military bases, that kind of thing. But it is quite crazy, really.
Yeah, I mean, it's maybe I'm falling into the trap of the people that I just kind of lambasted in the previous segment, but yeah, there are some pretty negative ways that could be used. Oh, but mind you, we're not here to debate whether things are right or wrong. We're just here to explain what they do and how you can understand them. But
I would say that
it's like a brain fingerprint or a facial recognition software taken to the nth degree.
Exactly. What it has that fingerprint technology doesn't have, you can't crack a computer and steal brainwaves in the same way. But what is interesting is that it's at such a high level of security, this technology, that essentially it could be used against you, but it would have to be in a situation where whoever was trying to do you damage had such control that the technology probably wouldn't make a difference. So if a criminal strapped you into an EKG headset and forced you to look at images of certain PIN numbers, they could eventually deduce which one was yours. But I like to think that if a criminal had that level of power over you, it probably doesn't matter whether or not they're using artificial intelligence against you.
Yeah, that's probably a bit sort of Bond baddie type situation, isn't it? Although if you apply it to the previous story, there are some pretty cool ways that could be used. Again, just integrating the way we live with technology. And if you were really integrating something like an exoskeleton or a neural bypass, and you wanted to make sure it could only be used by the person it was intended to, then you would tune that technology into their brainwave pattern, right? And that way the technology would be tailored to you, and it would really be an extension of your body. It would work with your body. It would work because your brain could control it, and it would only work with your particular brainwave. So that's pretty cool.
Yeah, if you think of it in terms of brain transplant, the same way you can't transplant a brain, you can't transplant a brain wave. So it does, it's that kind of nice symbiosis between biology and technology.
I guess we'll have to follow that one, and yeah. There'll be some interesting applications of that, but I'm probably not the person to come up with them. I'll just read about them and take credit for telling you about them.
Yeah, well, definitely one for us to follow. Nick, what's your last story?
The final one, which is probably a little bit more on the malign side, but probably more relevant to all of our day-to-day lives, is the story that you may well have seen on the BBC and various other news outlets, that a drone hit a British Airways aeroplane on, I think it was Sunday. Was it Sunday? Yeah. This Sunday just gone. They think people were flying a drone in Richmond Park, which is on the flight path to Heathrow Airport, and nothing happened to the plane. But when the plane landed, the pilot said, "Oh yeah, something hit the front of that plane," and they think it was a drone. It's kind of relevant for a few reasons. One, shows that something dangerous could happen if things aren't controlled, but it's also probably a sign that drones have become so ubiquitous. I mean, it was probably somebody just flying a drone in the park.
Yeah.
If you put all of those things together, that's probably what it was. But as drones become cheaper, more commonly used, I mean, it's the same as lots of technology, isn't it? Suddenly they become this thing that exists in the world. Lots of people have them, and lots of people have access to them. So you kind of have to regulate them, possibly, or you probably do have to regulate them because you don't want them hitting aeroplanes. But I thought that was interesting because it just shows how far drones have come from being something kind of military to begin with, and then real high end, technology to now something that you can buy pretty cheaply. You go on YouTube, you can find plenty of people who have drones with cameras on and filming themselves. I thought that was interesting, and I thought it was also relevant because I know that you've been doing some work speaking to people who are involved in developing commercial drones.
That's true, yeah.
So have you had a chance to, is that all under wraps for now? Misha, you're working on so many secret projects. I don't know what I'm allowed to tell people about and what I'm not allowed to tell people about.
That one's under wraps for now.
Have you told people about the exoskeletons yet? Misha's wearing an exoskeleton right now.
I'm actually recording this directly to your brain. It's all under wraps, of course. But this drone stuff is interesting. I think the most commonly offered solution is the idea of a drone register, the same way that you have a land registry or the DVLA exists. If drones can cause people damage, which we know they can, I suspect, though I don't know for sure, that a drone flown malignantly could probably bring down an airplane. At least that's what is often said. Yeah. It's really worth registering drones to owners. They are small aircraft. They can film people against their will. They can go to huge heights that humans can't reach. These things need to be monitored, I think.
Well, it just poses an interesting question. Is the way technology changes society. Who's going to, someone has to police the skies in the same way that they would police the roads eventually. Yeah. That's probably where that's going to end up.
Absolutely. And again, we've been talking so much about the flip side of these stories. The same way a couple of weeks ago I was talking about possible emergency response drones.
Yeah.
You can't have it all one way.
Actually, people do, just as a quick aside to the news, people do often write to me about things saying, oh, this is good or this is bad. And I tend to write back and say, well, you have to try and separate the ability to do something from its application, because the two are two different things. The ability to split the atom is the ability to split the atom. It has good ways it can be applied and bad ways it can be applied. But the fact you can do it is an achievement, right? You have to think that's an achievement that humanity has made. Now, the way it's going to be applied is very, there's a wide spectrum there. But I think you do have to separate the two things. So drones are pretty cool. They have lots of applications. Some of them will be good and some of them will be bad. If you were, stranded in the middle of nowhere and people couldn't get to you, but a drone could, and it could help you, could get you to shore if you were on a boat, or eventually you could get in it and it could take you to a hospital, you would like the fact that technology has been developed. But the downside is that people can do less good things with it.
Absolutely. And until we know, exciting either way.
Yeah.
Thanks a lot, Nick.
Cool.
So I'm here with Tom Luby, the CEO of Exobionics. My first question for you, Tom, is about your new product, the Exo GT. You've just received your FDA patent, or your FDA approval rather, so congratulations. What are your plans for rolling it out?
Yes, sure. One correction, first of all, though. Exobionics has been around for quite a while, 10 or more years, and actually we were one of the first exoskeleton companies on the market. Some people may not know that because I think that the recent news makes us feel like we are new to the game. But actually, our company was one of the first to kind of solve the power management issue. How do you have an exoskeleton that's practical, that doesn't consume more power and create a weight problem for the body? So we solved that problem years ago. And a number of years ago, we got into the medical market with an Exo or an Exo GT product. And very happy to say that just a couple of weeks ago, we received FDA clearance for the widest patient application for devices like ours. So prior to our clearance 2 weeks ago, some patients in the States and certainly in Europe, it's used in Europe as well, could use our products for spinal cord injury. And we are the first ones to have clearance for stroke. And our product is sort of unique in that it has variable assist, or what we call smart assist in Europe, that varies the power of each limb from 0 to 100% based upon what the patient's needs are. And that's what's unique about our product, and it's how it's used. And the FDA in the United States certainly agreed with that and gave us the widest clearance for the rehab clinic.
I understand. So can you clarify for me what changes have been made in recent years that have made it possible in terms of energy for exoskeletons to be useful? What changes have happened?
If you think back, I think the population at large has been educated about exoskeletons from the movies. and you see these things in the movies, and they're very large, and it looks like they consume a lot of power. Well, that's science fiction. The reality of it is it's got to be practical. And our business found very clever and novel joints. They solved a power management issue. So the joints in the knees and the hips, et cetera, allow these devices to consume far less power than what they did before that. So that's what it made them practical. But our business is also unique because we actually have a real business in military applications, but also industrial applications. So if you think about workers who are carrying heavy devices or using tools above their head, we have exoskeletons that can take the power, transmit that to the ground, and so the worker is actually just holding it there and using the tool, able to do things at higher quality, higher productivity levels, and far better safety. So what I say when we had these technological breakthroughs, they mean very real things to the medical applications, but also to industrial applications.
How widely distributed are these in an industrial capacity? How many units do you sell? How many do you expect to sell?
We started this business within Exo about a year ago, and we've had really good engagements from companies both in the United States and in Europe for early testing of these things. And we've learned a lot, I think, in the last year about what kind of applications they would like to see and made some refinements to our early products. So we have not sold a lot that we're going to talk about today. Maybe we can refine this answer. But what I would like to say is that this is going to be a very exciting business for Exobionics moving forward. And really, it delivers a lot of the same things as what the medical product delivers. How do you take what the individual can do and augment it enough that they have a better quality of life on the healthcare side of things, and a better quality of life and a quality of workmanship on the industrial side of things. So the business is early in industrial, but we're very excited about it.
It sounds a lot like you're tapping into the trend, or rather you're forming part of the trend for assisted robotics, because as you say, a lot of people's understanding of robotics is from sci-fi, and the real important application of robotics now, broadly speaking, is assisting humans in tasks they already do, but achieving a greater level of competence and dexterity and strength.
That's absolutely right. And what we were very happy to see in our work in the industrial side of the market is that we were thinking primarily about safety and maybe extending the careers of very skilled workers who have had their companies spend a lot of money getting them to that skill level. Actually, that's important. It turns out that it's just one of three things. Productivity. We have case studies that show just how much more productive workers can be with these assistive devices. And then the quality of workmanship can be that much greater. You can imagine when you're working above your head, changing a light bulb, just how much fatigue you can have, and imagine doing that with a drill or a welding device, something like this. You can imagine the quality level can go down. If you don't have to worry about supporting your arms or the weight of the tool, you can imagine that quality could be quite a bit higher. So it's quality, productivity, and certainly patient safety and extending the careers of skilled workers.
In terms of military applications, what kind of thing are you helping with?
We've had the I think advantage of having a good relationship with U.S. military contractors and so on to design devices to help soldiers carry heavy packs long distances, maybe first responder gear, things like this. We've done that in such a way so that we can use that IP and defer that in or project that into the industrial or healthcare businesses. Some of the IP and the underlying know-how of how to do the things that we do in industrial and in medical comes from those contracts that we've done over the last 10 years in the military. But I would say that right now our focus is primarily in what we call ExoWorks, our industrial business, and in ExoHealth, our medical business. Those are our two fundamental priorities right now.
Right. So going back to ExoHealth, do you expect exoskeletons to become the kind of de facto normal treatment for people in rehab, especially with neurological diseases? Do you expect that to become a very widespread thing?
I absolutely do. And again, I want to make sure your audience understands this is the here and now. We certainly have work to do to make these products standard of care. If you can imagine, healthcare practitioners, they are trained in medical schools, textbooks, et cetera, all written around standard of care. And just simply having a novel device that does something really great doesn't always win the day. You have a lot of hard work to do to produce clinical evidence, help to educate the key opinion leaders so that they can help to educate the rest of the healthcare practitioners. This is all work that our company and some other companies are trying to do, but the benefits are real. We can get patients up and walking in a rehabilitation setting on the very first session. These are sometimes people who have been relegated to wheelchairs for 40 years. The stroke disease is one that affects a growing number of people. There's up to 17 million strokes worldwide. In Europe alone, there's 1.1 million. That was in 2002. This is a disease that affects a lot of people, and we can help them very much in the early days. And then, because our device is unique, we can take that person and help when they recover some of their function. We can ease back on the assistance that we provide to them until they are back to maybe full capability in some cases. So that's why this is a breakthrough clearance for us in the States, and again, the parallel for that in Europe, where we have been on the market, but the awareness that we've got that sort of that credit that we are the only ones that have that capability.
So forgive me if I misunderstand, but it sounds like the robot assistance, in the case of rehabilitation, the assistance is almost on the part of the rehabilitator rather than the person being rehabilitated, isn't it? Is it performing the work that would be done by a medical professional in assisting somebody who doesn't have the strength to support themselves? Is that correct?
Yes, and thanks for the clarification, the clarifying question. These imagine when you have a stroke and you lose the capability on one side of your body. When these folks are rehabilitated, they have to go through speech rehabilitation, physical therapy, occupational therapy. And in physical therapy, if you can imagine a physical therapist or as many as three working with a patient who is, so you've got a physical therapist on the floor moving their leg, somebody else holding them upright. It's very stressful. There's a lot of stress on the physical therapist to get this to work. Now, there are other devices out there, but none that are quite like ours that allow the patient to have weight-bearing exercise and very early on and very safely. So that's what we're doing, is we're a tool for physical therapists to help them rehabilitate these patients. But one other thing I'd like to point out is robotic exoskeletons are real, and they're now, and we have to make them standard of care, and that's what our charter is. There is going to be a movement for home mobility, but these devices have got to become more capable, safer, and more cost-effective for this to be more in widespread use. But certainly, I think being an excellent tool for standard of care in the rehab clinic is the first step to that.
Getting off medicine for a second, this is a slightly more out there question. I spoke recently to a man called Zoltan Istvan, who's you might have heard of him, you might not, who's kind of a transhumanist who's interested in bodily improvement. I spoke to him a little bit about exoskeletons, though his perspective is not as involved as yours. And he speculated on a really, really wide range of applications, from kind of in Paralympics to civic transport, all kinds of things. Do you expect exoskeletons to become more than medical, more than military, more than industrial in the future?
Absolutely. We see applications, and you can say that maybe this is on the fringe of medical, but maybe it's an assistive device for elderly people who just need a little bit of a boost. And there's some devices out there on the market that help that. That's a big problem in Japan today with an aging population, and there are some companies that are focused on that. We have some ideas about that as well, but we think that the path to the broader adoption is to have the clinician and the healthcare practitioner become very familiar with what these things can do and what they can't do, and then become a spokesperson or an advocate for how these things can be used out in the population. We've also talked about it within our company as a recreation device. So we have bicycles that take us on the road or off-road even, and can exoskeletons be used in recreational capacity, I think is something that is interesting. It's not our current focus, but it's something that I think is on the horizon.
Very interesting. May I ask, by the way, obviously Exobionics based in the US aside, a lot of this technology seems to originate in Japan. Robotics seems to have its natural home in Japan. What's the scene like further west and in more readily investable countries as well, like in the US and like in Europe?
It's interesting you asked that question. First of all, I think that there is a lot of exciting things that are going on in Japan and Korea as well that we're quite familiar with. I think a lot of it is going on in the West. Certainly, we track all of it, but from Israel to Europe, certainly there's some new companies in Canada, and there's quite a number of them that kind of were born out of universities in the United States. So I think that the field is quite exciting. We look at it and from a business perspective, and I know that you've got a business, your audience is interested in the business angle here. It's not just about a clever design or a new CAD drawing or coming onto the scene with a new website. It has to be made into a real business, or these ideas will these new ideas will shrivel up or dry up, I should say. So I'm very proud that Exobionics has figured out how to make these things a real business. Now it's early. We have a lot of market development left to do. We have a lot of product development left to do in the medical side. And as I said before, we're early on the industrial side. But I think that our business knows the right moving parts for the business itself to make these ideas real and tangible. As I said, we're trying to drive to standard of care on the medical side. We need to drive to really good ROI on the industrial side, and I think we can do that. So every morning we wake up and we kind of scan the globe to see what Japan is doing, Korea is doing, etc. I think that they're interesting. The question is, can everybody make them a business? We know that we can, and that's why we're very excited about this recent news about the FDA, but more than that we have something here at Exobionics where we can deploy these robotic exoskeletons into multiple markets and do so successfully.
Speaking of business, my final question really, and apologies because it's a very slightly harsh one, you got a bit of an uptick in your share price with the FDA approval for the Exo GT, but otherwise it's been reasonably tough last year. Presumably your company, like many we cover, is one that really needs this adoption to happen, needs people to realize the nature of the technology, how cutting edge it is, and then it'll see a big uptick in its business and in its share price along with that. Do you think your company is of that type?
Yeah, I absolutely do. For a few different reasons, we have been relatively quiet with promotion and news stories about ourselves for about a year. And that was by design. It was something that we had to do while we were going through the process with the FDA here in the States. But the value is in our company. And if you look at maybe some comparators that are in robotic exoskeletons who have maybe higher evaluations, but they don't have the patient coverage and label that we've got for the medical device. They don't have an industrial device. And so that's why I'm very excited that now we are past this stage. We can talk a lot more about the value that's in this company. There are also some things that we want to do to get onto a higher level exchange. I think that will certainly help with the visibility of the value that we've got in our company as well. So I think really all signs point up for us.
Wonderful. Tom, it's been a pleasure speaking to you. Thank you very much. I might well be in touch in the future to speak again if you're willing. And thank you very much for an insight into your company and sector.
You're welcome. Thank you. I appreciate it.
That's all for Exponential Investor this week. If you enjoyed this week's podcast, follow us on Twitter and get in touch with me at misha@moneyweek.com if you have any comments on what we've discussed today. See you next time.